Hello, Jan. Welcome. We have,
We meet it. We meet at last.
yes.
Still beautifying. I have to redo from the panel. I had some water and a little bit of espresso. And
We are broadcasting onto Facebook already. I'll warn you that there could be a few people watching you beautify on Facebook.
what? Oh, my camera.
They like seeing the behind the scenes in this
I'm not
segment.
ready. Yeah, right. Well, I thought this was just a dress rehearsal. Okay. So are you
We,
serious? Okay. So can we do, all right, I just wanted your help with positioning the plant, so that's good. All right.
yep,
I'm gonna put on
looking
the light.
great.
Oh my God.
Now we have to set up the link on Facebook 15 minutes beforehand so that they can integrate it onto the web platform. Because we've got people watching on the portal, on Facebook, all over the place. But
Oh
for the
my God.
moment,
No. Behind the scenes.
this is self-care, making yourself look good so you feel good.
Oh my gosh. All right, that is true. Thank you for that. All right, two more things. So I just wanted to check the light. Light that I have doesn't last too long. I'm kind of new at all this, so as far as
We all are with this platform.
as far as the live thing. All right, here I am. So plant position is okay.
Plant position looks great.
All right. Well, I still have one more thing to do. I should just go off camera. I'll be right. Okay, so do you need to tell me anything about our timing or this is I don't
Um,
know if we're supposed to be talking about this on camera, but
oh, it's fine. We're going to be starting in about 7 minutes, and then your session will last for 50 minutes. Would you like people to be visible on screen? Because we can ask for people to sort of raise a hand if they want to be visible, or you just speak directly to me or Steve or whoever else is here.
I have no idea because I haven't done it that much, but I think it's fine with me. I think it's up to people if they feel comfortable. If they want to, that would be great.
We'll
Make it
just ask.
interactive.
They can raise a hand, and then we make them a presenter. They still won't. We have microphones on all the time. We can turn their microphone on if they want to ask a question.
Yeah, that sounds good. But I mean, if they want to, be seen and participating, that's great.
Yeah. And I find it helps to have someone to be talking to. When I'm talking to a sort of a blank screen, I've got no idea who's listening, what their facial reactions are.
That's true. So I just want to see. All right, so I'm going to do this because we're going to be doing. Is there a way to just gauge if people are, what um, what they might like as far as head, neck, shoulders? Because we're actually going to be working. We're going to be working on ourselves. I want people to be able to have something that they can come away with. So,
Yeah, well, anyone can write into the chat, and I can feed you things from the chat, or you can see it coming up on your window. There's also a Q&A, so they can be asking questions sort of through it.
Okay, great. I just want to try this and just see if you can see what I'm doing well enough, if I'm close enough.
Yeah.
Like you could. Hi, Steve.
So,
Both. Yeah, so you can see that. I mean, you
yeah.
can close enough. I don't have to. All right. And this will work.
Yeah, that works. We can see your neck.
All right. The only thing I'm not going to do is I'm going to tell people about how to position their feet and legs. Steve's already going on it. But I don't think I'm going to show it because it's too complicated. As far as far as the
moving the camera can be a little bit
thing I want to check because I thought this was rehearsal and nobody else was listening. But anyway, live check. I have been wearing my these, but can you hear me okay without it?
Yeah, I can hear you fine. You're all good.
Okay. My old computer is still kicking.
So for everyone that has come into the room already, if you'd like to raise a hand, if you'd like to be visible on screen, you can do that with the little hand marker saying request interactivity, or post in the chat, and I can make you visible on screen, as long as you don't interfere too much.
Never trust these dodgy embodiment people. Their heart's obviously in the wrong place, you know. I mean,
so we'll be starting in a few minutes with Jan Mundo.
Hi, everybody.
We'll just leave it a few minutes while everyone gets into the right room. I know it can be difficult sort of finding the links, working out the new system.
On that, anyone who is watching either in the room or on Facebook, we're going to extend the replays from 1 day to 3 days just because it's been bloody difficult today. So you don't need to worry too much. And for all those people that weren't watching because it was too difficult, you probably can't hear me anyway. But if you have friends, we'll send an email out to those people tomorrow morning and say, hey, watch Jan's session, watch these. I know it was really difficult, so we apologise.
We've already got a question. Someone is asking for some of your jaw care wisdom.
My
jaw care, looking after your jaw.
Oh, jaw care. Awesome. Good. All right, we'll do that. Anybody else? Any requests?
Yeah, someone else has also said about teeth clenching.
I think Mark should hop in for this session. No, he's been very stressed and has had that sort of thing going on in his sleep lately.
Like bruxism, grinding in your sleep.
Drawing blood.
Oh dear, that's very severe.
Wow.
Katrine, who says that she's had an intractable migraine for 15 years and she's tried most things. You're in the right place, Katrine. Jan Mundo, who we're with, is the headache master. She's the author of the Headache Healer's Handbook. She's a certified master somatic coach and body worker, and a self-care educator. So she will definitely help you with your headaches.
Indeed.
So, Yolanda, would you like to intro this one and I can switch off my video and eat?
Well, yeah, so that was a short introduction.
But yeah, once it gets started in like a minute or whatever anyway.
Yeah.
So I'll be listening in the background, so catch you, Jan.
Okay, yeah. We're getting started, so that's a good thing.
Yeah, it's 7 o'clock, so it will get started. I'll just give a short introduction again. I'm Yolanda. I'm helping to moderate the self-care weekend and managing the meditation channel for the Embodiment Conference. And I'm here with Jan Mundo, who's the author of the Headache Healer's Handbook. She's a certified master somatic coach and body worker and a self-care educator. She's helped with headaches, migraines, trauma, and body work for many, many years. Developed a somatic self-care program that she's taught at medical centers, universities, and for corporations, including the Osher Center, Stanford University, and Apple. So I will stop reading from my blurb and take it over to you, Jan.
Hi, thanks so much, Yolanda. It's really good to be here and to have everybody here. What Yolanda maybe wasn't sure about is I've been doing this work for 50 years. And really it's based on feeling the body and palpation and, working with ourselves and going into our own pain. And what I wanted to try and do today is, this is about self-care, is to give you as much as I can in 50 minutes that you can use at home or wherever you are, really. And so what I'd like to focus on is touch and hands-on work, and also the background for that, because really it's all body work. So really as as in daily life, we just go, even in COVID times, and we forget to pay attention to our body. So, in order to actually work on ourselves, there are principles that and ways to go about it that help you not only become more aware of your pain, but be able to do something about it and also be able to not collect so much of it. So how we're going to start the touch is actually with working with these kind of concepts and principles and getting your body ready to receive the touch. So the first thing is, we want to come home to our body. And the first thing that everybody could do, and one of the really best things that you can do for yourself, just stop and take a few breaths. So let's just take a few breaths all together. And I always say, try and breathe lower, not necessarily deeper. So see if you can, one way to help with that is to put a hand on your belly, below your belly button, and just cup it around your belly, and just see if you can breathe into your hand. So let's why don't we start with that. Take 3 breaths. And if you can let it out with a sigh, that'll feel really good. Okay, so that just gets the process going to come home to your body, because usually when we have pain, we want to escape it. We want to either ignore it or take a pill. And so this is a way of really coming home to your body and getting curious about the pain and actually going into the pain instead of just trying to get rid of it. Well, we are going to get rid of it, but it's by being with it, getting really present to it, and seeing how and where it lives in your body in order to then release it. That's what empowers us. Okay. So the thing about working on ourselves, you can work on yourself seated, which is, I work with people a lot that way, and with myself a lot that way, because so much of the day we're sitting at our screens in one way or another. And so, or sitting doing something. And so helps actually work on yourself in the postures and positions that you're used to having and getting a new orientation there. That's one way to work on yourself. Another way to work on yourself is lying down in bed. And a lot of the techniques that I discovered and ways of working more deeply, really I discovered lying on my back or in whatever position in bed and just working on myself. So you go in layer by layer by layer and really let it release. And then it changes your zero, as far as what you're carrying around with you and what you being able to release what you've collected. So, but today we're going to work in the chair. And so what I recommend is a straight back chair, and just, something that you're not going to lean up against, because a lot of times if we have, say, an office chair that we work in, and it has a high back. A lot of times people will lean back, and then so one of the best ways that we can take care of ourselves is to sit in an aligned posture where we're using gravity and our body is aligned so that we're not doing muscle contractions with our upper body, shoulders, neck, and head, even in sitting. So we're going to first start with settling our bodies, and that's the first thing that you can do as far as work on yourself. I'm kind of short. Last measurement, I was under 5 feet, which shocked me, and I'm going back for a redo. And so a lot of times, even in a shorter or, just a simple straight back chair, I don't feel like I make good contact with the ground. And so what you want to do is sit on your sits bones. And it's kind of hard to show all this on camera. So, but basically, your ischium, if you roll your pelvis, if you kind of arch your back, play a bit. See? Okay, yay! All right, so if you just arch I'm sitting here, so I'm not rolled back like that, because if I do that, this is what I was just talking about. See how my head's forward? And then you're using these neck muscles and all these muscles to hold your head out of position. So what we're going to do, so putting yourself in position is really like doing a massage. It's like giving yourself a massage from the inside. So how I have to sit a lot of times, even though this is a pretty short chair, up in the chair so that I can really feel my feet on the floor. So it really starts with your feet. And my feet, going to be harder to show, but they're hip distance apart. And they're turned parallel, straight forward. And why this is important, and then my knees are open, I think. So that you make a line between your hip joint, you can put your fingers here, and then knees, touch your knees, and then your feet. So that you can let your weight down into the ground. Because how are we usually? Leaned into the screen. I know I am, and I know I've been practicing this work because to become a somatic practitioner, and all these things that I've trained in, you do it on yourself, right? And you work with others. So, really, as much as I know, I find myself like this. So all these practices are things that it's good to set aside time where you can just slow down and do it, but also these are things that you do while you're living. So so you make a loop between what you're doing, say on the computer, and using that as an example because that's where I've been living lately, your body. And so it always starts with your feet. And so can you feel your seat in the chair and feet on the floor? You can feel your feet, pressure of your feet on the floor. That's what you want to go for. Because then, can you feel the difference between this, you have high, and a lot of times people tuck their feet under. And then just letting your weight drop. So right there, you can see how it lets my shoulders settle. Do you feel that? And then the other thing is to align the top part. So, and I showed you why. I think because we're like this, which contracts back there, or like this. And either way, we're using our body in ways where we're not taking advantage of dropping in gravity. So, you want to just touch the side of your ear and side of your shoulder, the side of your hip, and then draw a line. And you can do this, also in your own mirror, so that it should be a vertical plumb line, so that you're able to let your body settle. So right then, just notice what happens in your shoulders when you do this. So that starts the massage of your shoulders, neck, and lower skull and jaw. So the other thing that I can also do, I'm noticing when I'm doing it, is just like, I don't want to push my chin in too much, but a lot of times when I work with people and say, okay, well, bring your head back, they'll bring it back this way, which also creates a contraction when they're trying to put their head over the shoulders. Because our bodies get stuck that way because we built the musculature and fascia in that way, right, over time. So you want to just, it's kind of like having one of those glider rockers. Just have your shoulder, your chin straight, like you're looking straight ahead. Okay, so that gets us started. And that's a way to center as part of the massage, because then you're not working against yourself. You don't have to work as hard. And what we're going to be doing is working with fascia. So fascia is really fascinating stuff. Of course, we're also going to be working with our muscles, right? But the myofascial system, fascia is this kind of gel and has all these properties that they're learning more and more about, ways of conducting. But it keeps our body together, and it's at every level of muscles and all throughout our body, our organs in place. So, and it's very malleable to hold and stress, and it's a conductor. There's a lot of things that it does. And so there are ways of working with the fascia where you can ease it in the moment. And so that's what we're going to be doing. So a lot of times I talk about that as tissue. And if your muscles are tight or your fascia is tight, then we want to work from general to specific. A lot of times when people have pain, like if I have shoulder pain, a lot of times it just feels like my whole shoulder is painful. But if you go to work on it and break it down, you will find a bunch of collection of painful points. They've been termed trigger points a long time ago by Janet Travell in myofascial trigger point therapy. But they're hot spots. They're places that feel tender or tight, and those can be eased out. You don't need a pill to ease those out. You don't even need a massage therapist. You can do it yourself. So that's what we're going to. All right, so if your shoulders are tight, I have two principles or anywhere tight. I have two principles of working with that tightness. And the first one is called puppy dog paws. So it's when your hands are really soft. Everybody make puppy dog paws. And because you don't want to put tight hands on yourself. So for example, if you just put your left hand on your lap and then make a claw, and then on the back of your hand, just place your claw and just kind of don't rub over the surface. Take this claw and try and get in there with a tight hand, and just see what that feels like. Okay, now I'm just doing it up here so you can see. But and then instead of that, have your puppy dog paw and just place it on the back of your hand and kind of mold it. I'm just going to hold it up. You can feel how you can get inside the webs and how your body wants to let it in and how you can feel more under your touch. So it's both when you're working on yourself, what they call interoception and exteroception. So feeling your pain or your body from the inside, and then also you can feel what it feels like on the outside. So it's like splitting your attention. It's really exciting, actually, to work on yourself. Okay, so those are puppy dog paws. So you always want to put soft hands on yourself, right? Treat yourself with love, there. And then the other thing that you saw me do, so this would be effleurage. So if you're going for a massage, and the massage therapist putting lotion on, that would be effleurage. It's a smoothing stroke. But the way to really get in layer by layer and get into the tissue so that you can actually release it is by latching on with what I call little frog bath. So I'm just holding it up, but you can do it on your lap. I'm just latching on like little tree frog, where I'm not gliding over the skin. So can you feel how get in more deeply that way? Right. So those are the two principles being effectively that I use to be able to effectively work on yourself. And then the other thing is that I talked about this before, is that you want to match your touch with your pain. And then also we're going to match mind with our touch and our pain. So that it's like a meditation in a way. Like, so you're not thinking of something else. You're really putting your mind right where the pain is. And by doing that, you supercharge your touch, supercharge your ability to shift that point or that painful area. First of all, because you can be curious about it and just see, well, what happens if I press this hard or that hard? Because you want to meet the pain at its own level of tightness. So you want to press too hard. That's why you go in with soft hands. And so you want to go in layer by layer. And so what I mean by that is you can start just with, I always work from general to specific. So you can start with like generally warming up the area like you would with bread dough or like you would with clay. So hard, cold clay is really hard to work with and mold, and it breaks apart. But when you warm up the clay and you knead it, then it becomes malleable. So that's really what you can do with tissue. And so that's why we work from general to specific, is what I call you smush the tissue layer by layer. So let's start with our shoulders. And because really one thing begets another. Your shoulders, neck, head, jaw, they're so connected with myofascial pain, headache, and migraine. And so why I work on the opposite shoulders, that you don't want to engage the same side, that the muscles of the same side you're working. So I always start with on the opposite shoulder. And so you can just let your elbow kind of rest on your chest. If you have a small pillow and you want to use that like a little prop between your elbow and your chest, you can just place that, something really thin. But anyway, so first we're going to do this general stroke. And so when you work on yourself, it's a little different, because if I were working on you, say if you're sitting in a chair right now, I would work behind you with my thumbs in your back, on top of the scapula here, just this whole kind of build up this trapezius muscle that I know I have right now. But when you work on, and I would use my thumb, but when you work on yourself, anatomically you can't do that. So instead, I use my fingers as all one piece, and then I squeeze between there and my heel of my hand. And so the first stroke basically is a squeeze and hold. Press fingers and the heel of your hand together. And then you also want to have, I know I'm not facing you right now, but you want to have your head on straight. You don't want to have it turn, because then you feel if you do that, it tracks the muscles, right? So just do that and feel into the shoulder. Breathe. And let your tongue rest on it softens your jaw. And this hand too, you don't want to be stretched out. Just have it next to your body, the hand also. So I started with my right. So just thing. And then you can release your grip a little bit and go a little up towards your arm. So right now we're basically working the shoulder ridge. A lot of times I'll be pressing in more on this scapular ridge. You can feel it's the top of this more or less triangular bone. And then especially there's a point right here. You can usually get it with your middle finger, but I'll press in even more. You can do little circles there. Okay. So, and then you can just like the same territory that we just did, do a little faster stroke, just like a squeeze and release. Can you hear me when I turn this way? I hope. Okay. So I'm going to stop here and turn around. So whose arm is tired? Mine. So the arm that you were working on, so my right arm, that was the working arm, really tired. So I always treat it basically whatever I'm working on like I collected real stuff, right? And now it's in this other arm. And yeah, you use those muscles, but to me it seems like a lot more, because if I were lifting a weight or carrying something for that long, it wouldn't really feel as pull up as it does, or tired. So what I do is I get rid of it. And so healers do this all the time too, and different healing modalities have different ways of doing it. Basically, you shake out the working arm. So I'm extending my arm, and I'm really extending my fingers, like stretching them out. And then also you want to head kind of towards the floor. I do it on the diagonal, because if you do it up high, then you're still using these muscles. So you just kind of let it go toward the floor, not like toward the corner if you're in a room, or some people stick it out the window, but I don't want you to. So, and just keep doing that. Extend. So extend. Extend. So that until your arm doesn't feel tired anymore. Does it start to feel a little bit like it's at least what you collected? All right. So yeah, you can shake up the other arm too. Good idea, Yolanda. All right, this is the one you worked on. Okay, so we're not done with this. So can you feel, now it's good to check your posture again, because we get out of alignment as we're working ourselves. So align here and check your feet, right? Feel your seat. So see that you don't work against yourself. All right, you can feel the difference between your left and right shoulder. Maybe you notice. All right, so we're not done with that shoulder yet. So now we're going to go even deeper, because that's really how to release pain in your. I use that technique basically in shoulders and neck. All right, so here's how we go deeper. You can use your hand again like a little tool, and so first we warmed and softened the area. So can you see it? Feel it. If you feel it, see if you can notice that it feels more pliable, maybe warmer. Some top two layers feel like they can move them more, right? So another thing that I use the squeeze and hold and squeeze and release for is as a diagnostic for you to notice where there are hot spots. So now we're going to go in basically detailing work, our detailing. So you latch on with your little frog pads, and you can do this either on top of your clothes if it's not a thick sweater. Or you can do it underneath, whichever way you can get the most grip. For what you're wearing and how you feel that day. So I use my fingers like a little tool. So you basically do this. And you can do the ridge, and you can do towards the back. And so you just you can go along the ridge. And here again, you can do diagnostically of what's moving. And so how deep you want to go is how deep it takes to make contact with pain. Again, you want to have your head on straight. Like I felt myself starting to turn toward the camera so you can see me, but then I can feel this muscle.
Sorry, Jan, a few people are having difficulty hearing you when you face away from the screen.
Yeah, I was wondering if that would happen. Sorry, everybody. Okay, so I'll talk hopefully, is this better? Glad they said something. So basically, can you see what I'm doing? So I'm latching on, I'm doing these little circles. And so, and then when you come to a little circle, when you come to a spot that feels like it's painful, you can stay on it a little more and press just to the point where you make contact with the pain, but not are making more pain. Until that layer becomes more pliable and moves more. And if there's still pain in that spot, you can press a little more at that depth of pressure until there's really no discomfort in the point. And then you can move on to another one. So that's basically how you can relieve pain in your shoulders. And then I'm shaking it out again. So let's do the other side because we don't want to ignore it. And there are two ways that I do this. You can do it like dough, where you let the dough rest. So you can do, say, squeeze and hold, squeeze and release, like we just did, and then do it on the other side. And then come back, like after the dough is rested, and then do the little circles. So more specific, right? So, and then remembering to breathe. So I'm, again, squeezing with my fingers and back. I'm basically squeezing the shoulder, the top of the shoulder, and heel of my hand and the fingers. Take a breath. And then going out to the shoulder, towards your arm, and then squeeze and release. So I'll do this side. It's a dilemma because it's like, hurry up and wait. I don't want to ignore it, but if I spend as much time on it, we won't have time for other stuff. So sorry, shoulder. Afterward, you can go back and work on it. And then doing the little circles. So latching on this and doing little circles. So you can do it on the shoulder, the back, on the top of the ridge. You can do this point. The levator scapula is the attachment point where the shoulder blade attaches to your neck, lower skull. And then you can do the top of the shoulder ridge. So there are a number of ways that you can work it. And when you work all these points, and then also go back and focus on the tender ones, tighter ones, you'll find that shoulders don't hurt. So it's just breaking it down bit by bit. Yeah, and you can hold. The only thing about holding your arm, that then you're going to be, you hold your elbow of this arm, then you're going to be using the muscles and the fascia of the arm, of the shoulder that you're trying to relax. So it's a little tricky. So I don't have any small pillows here right now, but that's kind of what you want to do. Just a very small, flat, like a, some way, a prop. Is that better? All right, and then shake it out. All right, let's move on to the neck. So the neck, is, I work the neck like it's a box. So you have the front, sides, the back. So basically we work on the back and the sides. And I work on the head the same way, really. Back, sides, top, and the face. So I need more hours to do this in, but we're just going to work generally. So the neck, you can work the same side hand as the side of the neck that you're working on. But I always do both sides because it's a little different positioning, kind of gets the areas differently. Do the doggies. All right. So again, we're going to do the same squeeze and hold and squeeze and release, heel of the hand and the fingers. But you can kind of just do a little traction toward the back, like in back of you, that way. So, and then just let this elbow kind of turn near your ear. And so the first one is a squeeze and hold. And breathe. So could you see the positioning? All right, so, and then, so you can start up toward the base of your skull. And then you can loosen your grip and go, say, from the middle. And then just a little bit lower around what you call C6 and C7, or your cervical vertebrae, or the hump. Okay, so, and now just do it a little faster, squeeze, release, squeeze, release. And then let's go ahead and shake that arm out. Oh, I forgot to mention, make sure you're not near furniture, because you can whack yourself. Whack yourself good on furniture. You'd be surprised. All right, so now let's switch and do the left side. So, see? So as you're doing that, just take a breath. And then release your grip and go more toward the middle. And then now, hold it up. All right, and then do it a little more quickly. Okay. And shake it out. You can get more specific on the neck as well. For instance, you divide, make a dividing line and just trace your finger over your spine from your neck to those bigger bones. Next, C67 sticking out. You can do those little circles that we did on either side of your spine. So if you start right on if you're on with your right hand, just on the side of your spine and do these little circles and then kind of spiral up. Or if you start at the bottom of your skull, you can spiral down. So now, and then I already did one, so I'm going to come back and do one. A little farther away from the spine, a little farther laterally out to the side. And just into your lower skull. And then I'm bringing my hand out, just basically that box would be the right corner of the back of the box. So there again, shake out your hand, felt hot spots, you can come back and do little circles and layer by layer go over those. So then take your left hand and do squeeze and hold. And again, I'm going to do an abbreviated version here. And then squeeze and release. A little quicker version of squeeze and hold so that we're mushing the tissue. I'm just paying attention. I know I'm talking to you, but I'm really splitting my attention and paying attention to what underneath my fingertips and the heel of my hand. So, and then doing little circles just to the side of your spine, working from the lower skull and spiraling down little circles. I'm on the left side right now. And then when you come to the top of the shoulder, moving your hand out laterally side, so you're basically in the middle of the side of the back of the box, the middle of this, and then the corner, and then just shake it out and noticing, letting your head settle on your shoulders. Okay, so just noticing now your neck and shoulders. Do they feel a little looser, a little softer, with the more mobility? Taking a couple of deep breaths. Okay, so let's move on to the head. So take my glasses off for this one. So again, the head like a box. And so using our little frog pads, I go under the hair. And so we'll just work our way up. So little circles. So you just splay your fingers out. The idea with working on the skull, the scalp, sorry, is to get the skull to move. I said that backwards. The idea of working on the skull head is to get the scalp to move. And so we're not trying to go deeper, I'm just trying to get it to move. So, and I do it pretty methodically. So you saw me go up the back. It didn't take long. You can do it a lot slower, really. And then when I do the sides, I splay over my fingers over my ears, and I work my way up. And the stroke that I'm doing on the side, let's go straight in, is, and my pinkies are near the hairline, is I'm going toward my face. So that's another way of releasing it, is by the direction. Right? You can do a couple of passes. You can do it. I'm doing it easy version, but you can take as long and as much time as you need. And then the top of the scalp is you can put your hands this way, kind of mold it around the hairline, and can do little circles again going in, so the pinkies are versus going out. Because what I want to do, a lot of times our face, we have what I call social face. Everything's contracted. So this is a way of counteracting that. So you can go straight back with your fingers this way. Or you can do little circles, or you can do what I call back and forth. So just latch on and do this. Looks really weird, right? But it's a good thing. You want your forehead to move. This head massage, well, the whole thing that we've been doing is really great for tension type headache. And for myofascial pain that can lead to both tension headache and migraine. It's like, can I talk while I'm like zoning out, relaxing? I can, but so really that's what you want to do with the scalp. It's not to go in more deeply, it's to get it to move. So, and then if you do this a little slower and kind of work with it and really focus on it, sometimes you'll feel your scalp start to tingle or just warm a little bit. All right, and now let's work on the face. And again, you can do this like as a practice, like on a daily basis or 5 days a week, or, kind of alternate with other practices that you might have, like meditation practice or yoga or gentle exercise in some way, and you can do one on one day and one on another day, but it helps to just do this even when you think of it, just sitting at your computer and like, oh, my shoulders feel tight, and then stop, align yourself, and then work on just your shoulders or your neck or your head. You can see we're doing a lot in a short amount of time. And so again, you don't want to like speed it up, but if you just even did one thing, then that would be looser. Even though really in a way they're all connected, but sometimes one area is screaming out, right? So now let's work on the face. Now, I also want to mention that if you have a migraine, during a migraine, a lot of what we've done will usually be too strenuous. Even though we're sitting here and I'm saying even go slower, it's like because you're creating more movement. And pain of a migraine is just this pulsing, pounding pain. It's hard to move, and sensitivity to light and sound and odors. That can, even the amount of movement that we did, even some of the squeezes and squeezing holds can be too much for someone during a migraine. However, with a lot of migraines, people will have like a spot in the back of their lower skull or their neck. So you can just gently work on those spots. But you don't want to be too strenuous. So the headache therapy that I do, hands-on headache, like a transcranial headache therapy, that is a way of calming down the migraine. So that's more what you want to do, something calm. But so a lot of these things that we're doing are to prevent. Okay? However, you can do everything you've done to release tension type headache, and also to release, as I was just saying, those stuck spots that tend to lodge in as part of migraine. So the next thing is the face. And I mentioned social face before. We can carry around tension without even knowing it, especially people in service jobs. And now it's just all weird because how do you smile at somebody from behind the mask, at least in the United States? How can they see that or project it? So in a way, maybe people's faces are more relaxed because they're like, they can't see me anyway. And so the contact is changed. It's a whole sociological experiment, I think. But a lot of times in the past, and there are a lot of places that are opening up, so the United States, but the way that we have of connecting is very, verbal in a way in our face. And so it's like we kind of prop ourselves up to be present. And so that gives us a lot of times these tightness in our face, facial tightness, or habits where we're not even aware that we're doing it. Like I can feel myself doing it right now. So it's like kind of this contraction here. So, I'll be polite about it, but in another way, it's resting face, right? The opposite of resting face. So when you work on your face with self-massage and putting your awareness there, you can kind of get back to it, help it get back to its relaxing and relaxed state. Sometimes it can be, when you work on your face and releases the fascia, one client described it as manual Botox because, it just relaxes everything that's been tensed up. So that's what we're going to do now, and including the jaw. So we want to latch on with little frog pads and just put your fingers so that they, your pinkies are together, and then your other fingers are kind of separated and in contact with your hairline. So you see there? So then these I'm going to go toward, I'm going to go in. Because again, we're counteracting that contraction that's all pulled out of the face. And then, so I'm just getting it to move. And this is like with the scalp and the skull, where I'm not trying to go more deeply. I'm just trying to get it to move. And I'm working my way down the forehead. My first finger is making contact with the ridge of the temple, the bone of the ridge. So I'm pressing in and just making, if I feel tenderness, I'm making contact with it so that I'm working at that depth pressure. And then you can take your fingers, use them like a piece, and just do this whole area of the temple. Again, it's good to check your posture to see, are my feet flat, the distance apart, my body, top of my body in a straight line, vertically. And
Hannah, I don't want to rush you, but we have 2 minutes left.
oh, that went fast. All right. So that's the temple. Let's keep going down to the jaw. So that right at the jaw joint in front of your ear. And then squeeze, you can squeeze between your fingers and your thumb on the bone. Just press and release. You get to the chin, and let's just finish with the eyes. Okay, so just pressing on the brow, just press in, splay your fingers out, press in. The short version. And the sides of the eye socket on the bone, and then the cheekbones. Press and release. And then going down more the jaw, but a little closer in. All right. So, and then just shake out your hands and notice how you feel. What feels looser? What feels happier? Where's there more movement? Where can you breathe into? What does it feel like to pay attention to your body and yourself in this way? So I hope that you will continue going with what you learned and that it was helpful. Thank you for joining me.
Yeah, thank you, Jan. As you can see, I was participating for the whole thing, and that was wonderful. Jan will also be joining us for the full Embodiment Conference, which is the 14th till the 25th of October. If you haven't already got it in your diary, you can put it in now. And also on the Embodiment portal, you'll be able to like her session and automatically add it to your Google Calendar. This is the new technology coming soon.
And you can visit me at theheadachecoach.com.
Yeah, I'll put that link in the chat for you. 1 second.
Awesome. And so what are you noticing about yourself? We have what, 2 minutes?
1 minute. 1 minute.
What do you notice?
We've got someone commenting saying, this stuff is amazing. For years, I've been having a headache. I thought I was for thinking too much, but relaxing helps. Only during relaxation. Now I feel released for the first time ever. Thank you so much.
Oh, I'm so happy. That's awesome. Who said that?
That was Peter, I believe.
Peter.
Someone says lightness and more smile. And
That's
feeling
good.
ready for a nap.
Oh, that's awesome. All of that is perfect. And you look kind of, your face is all glowy and you look very...
I'm definitely glowing. My hair's a bit all over the place, but I'm glowing inside and out.
Yeah. I'm so glad everybody came. Yeah, you look a lot all glowy. I'm so glad everybody came and that I hope you benefited and it's great to hear that you did, those of you that said, and so just keep noticing and you can do this anytime, anywhere. Just a little bit even helps, so. Thank you again. Thank you to the Embodiment Conference, and this is a wonderful, there's so many wonderful sessions, even in the Self-Care Summit.
Yeah, there's been fantastic sessions already. We've got one more starting in 10 minutes. We've got David Baselli. You can find the link on the embodiment portal. And I'm just putting some links for the embodiment circles into the chat here.
Thank you so much, Yolanda.
Thank you, Jan.
For hosting and for participating. I really appreciate it.
Okay, thank you, everyone. We're going to stop the broadcast.